Okay, let's jump right in. Picture this. It's 2003, and we're in the Republic of the Marshall Islands. A huge measles outbreak just explodes, seemingly out of nowhere. But here's the thing. This was a community that thought it was safe, that it was protected. So how on earth did this happen? That's what we're going to unravel today. And that really is the million-dollar question, isn't it? How can you have a massive, devastating outbreak in a place with high vaccination rates? I mean, on paper, everything looks good. They should have been protected. So what went wrong here? What did everyone miss? Well, the difference between what they expected and what actually happened, it's just staggering. You see, health officials were looking at vaccine coverage numbers between 80 and 93%. At that level, you'd think, okay, measles should be pretty much under control. But the reality? It was a nightmare. We're talking 1,800 cases, 100 people hospitalized, and tragically, 3 deaths.
So you can imagine the scene. The investigation kicks off, and it's a real puzzle. The numbers just don't add up. How could a community that's supposedly so well vaccinated get hit this hard? Public health officials were scrambling for answers, and they needed them, like yesterday.
And then they find this one statistic that just sends a chill down everyone's spine. Get this. A full 41% of the people who got measles had already been vaccinated. Think about that for a second. The first, most terrifying question that pops into your head is, did the vaccine fail? Was this vital tool completely useless? All right, so to crack this case, investigators had to get on the ground. A team from the US CDC and the local Ministry of Health fly in, ready to start searching for clues. And what they discovered was a community and a set of living conditions that were, well, truly unique. They zeroed in on the epicenter, a place called Majuro Atoll. Now, this is a tiny, narrow strip of land, but it's home to half the country's population, and it accounted for a whopping 90% of all the measles cases. So this was ground zero. The team started going door to door trying to piece together what was happening. And right away, they started noticing something incredible about the way people lived. The first clue? The sheer number of people in each home. We're talking a median household size of 11 people. That's whole extended families, grandparents, aunts, uncles, kids, all living together under one roof. But hold on, it gets even more intense. It wasn't just crowded houses, it was crowded rooms. The investigators found a median of 5.5 people sharing a single room. Just imagine that. It's the absolute perfect storm for a respiratory virus like measles to just rip through a community. To put this all into perspective, the population density was almost 2,600 people per square kilometer. You know what that stands for then? The city of Chicago. This place wasn't just crowded, it was a tinderbox, just waiting for a single spark. You know, the researchers who wrote the report on this outbreak, they summed it up perfectly. They said that these kinds of living conditions could spread a virus just as easily as a packed school. And we all know, schools are basically petri dishes, some of the most efficient places for germs to spread. So you have this incredibly dense community, this perfect storm for transmission. Naturally, the investigators had to turn back to that first scary question. Was the vaccine actually strong enough to hold up under these extreme conditions? Was it failing? And this wasn't just a local question. The answer had huge global implications. I mean, think about it. If the measles vaccine couldn't be trusted, it would throw public health programs all over the world into chaos. So they crunched the numbers. They looked at what happened when measles got into a household. For people with 0 doses of the vaccine, the attack rate was 52%. That means more than half of them got sick. Now look at the vaccinated folks. For those with 1 or 2 doses, that attack rate absolutely plummets down to just 4 and 3%, a massive difference. And that data leads to the big twist in this story. The vaccine wasn't the villain here. It wasn't failing at all. In fact, it was working incredibly well. Even with that intense, in-your-face exposure of a super crowded home, a single dose was 92% effective. That is amazing performance. So, the verdict is in. The vaccine is innocent. It worked, and it worked beautifully. And on one hand, that's a huge relief. But on the other, it just makes the mystery even deeper. If the vaccine wasn't the problem, then what on earth was? Okay, so with the vaccine cleared of all charges, the investigators had to look elsewhere. They started digging into the nitty-gritty details of the vaccination program itself and the unique dynamics of the community. And this is where they finally started to find the real culprits hiding in plain sight. Here's what they found. The coverage for the first dose was actually pretty good, around 88%. Not perfect, but good. But the second dose? That's where the problem was. Second dose coverage was way, way behind, somewhere between 40 and 68%. And that created this huge critical gap in protection, leaving a whole chunk of the population only partially vaccinated. Then they looked at who was infecting whom, and this is fascinating. The people who were bringing the virus into the home were older kids and young adults. The median age was over 11. But who were they infecting once they got home? Tiny kids. The median age of the people who caught it inside the household was just 1.4 years old. So you can see the chain of infection, right? An older sibling or a young adult, maybe someone who missed that critical second dose, catches measles out in the community. They bring it home, and in those incredibly crowded houses, they pass it right along to the most vulnerable people imaginable, babies and toddlers who are still too young to even get their first shot. And this tiny, defenseless group, they accounted for nearly a quarter of all the cases and over a third of the hospitalizations. They suffered the most. And this really all boils down to that concept we hear about so much, herd immunity. The idea that if enough people are immune, the virus just can't find anyone to infect and the chain of transmission breaks. But here's the crucial point. The bar for herd immunity isn't the same everywhere. In a place as hyperdense as Majuro, the virus has so many opportunities to spread. You need a nearly perfect wall of immunity to stop it. And that 88% first dose coverage, it just wasn't high enough to build that wall. So, after all that, what's the big lesson here? What can this one specific intense outbreak teach us all? Well, it turns out to be a really powerful universal lesson about what it actually takes to build that shield of immunity for a whole community. And I think the biggest takeaway is this. An incredibly effective vaccine is absolutely essential. It's the cornerstone. But it's not the whole story. It's just one piece of a much, much bigger puzzle. So let's break down what this case really teaches us. First, context is everything. Places with super high population density need exceptionally high vaccination rates, way higher than average, to stop an outbreak. Second, your strategy has to be rock solid. Good first dose coverage isn't enough. That robust two-dose program is absolutely critical. And finally, and this is maybe the most important point, this is why we do it. This is why we build that shield of immunity. It's to protect the little ones, the babies who are too young to be vaccinated themselves. And all of this leaves us with one final and I think really crucial question to think about. When you're up against a virus as contagious and as relentless as measles, is good enough coverage ever truly good enough to protect everyone? The story of the Marshall Islands seems to scream that the answer is no. And that's a lesson we just can't afford to forget.